Welcome to Business Connection. I'm Liz Spencer. We have a fascinating guest in studio. It's Dr. Aaron Weiner, and he's the Director of Addiction Services at Linden Oaks Behavioral Health. Welcome.
Thanks for having me.
Tell me a little bit about Linden Oaks.
Yeah, so Linden Oaks, we're known for behavioral health. We're known for the hospital and for mental health, but we actually have a very strong addiction service line. We have a detox unit in the hospital, 12 beds. We manage a residential facility up at Northwest Community Hospital, and we have 4 outpatient centers in Naperville, St. Charles, Plainfield, and Hinsdale. So we've really got a pretty robust addiction offering to go along with the rest of what we do.
That's wonderful. I know that we appreciate having Linden Oaks in our community. It's a wonderful addition. We're here to talk a little bit about the opioid addiction. How big of a problem is that? We read a lot about it in the news.
Yeah, well, it's been termed an epidemic, and I think that's it's a label that's accurate. 91 people are dying a day nationally from this. The United States actually consumes 80% of the world's opioids, and we only have 5% of the world's population. It's a huge deal, and here in Illinois, actually, it's particularly high. We've got twice as many people dying from opioid overdoses than we do from car accidents, and 1.5 times as many dying from opioid overdoses as all homicide deaths. So it's really very present.
Wow. And to take it one more step in local, where's Naperville fall on this scale in our concern with this?
Yeah, so it's definitely here as well. I guess just a few ways to frame it. So we get overdose reports every month from our ED, and people are coming in, young and old, having overdoses. Our coroner, Dr. Jorgensen, released statistics from 2016 showing that heroin and fentanyl deaths are absolutely still going up. And actually, there was a county-by-county chart I saw recently that showed that DuPage County is growing faster in terms of overdose deaths than actually pretty much any other county in the Chicago area. There's more deaths in Cook County in general, but we're growing at a faster rate. So this is actually something that's very present in our community right now.
Well, and Linden Oaks has stepped up to help us. So tell us about a new clinic that you have put together to address this great big problem.
Yeah, absolutely. So we're opening a medication-assisted therapy clinic, which is a clinic where we use medications, as the name would imply, to help people deal with opioid addiction. So when someone's using opioids, they actually have a choice of a few different medications that they can use that when you take them, they stop you from going into withdrawal. You're not going to have cravings, which is what would normally happen if you were stopping without any help. And if you were to use opioids, you wouldn't get high. And so these are tools that are evidence-based to help people are able to achieve and maintain sobriety for longer when they use them. And we've actually offered them in our other programs thus far. We can offer it out of our residential, detox, outpatient, all of it. However, it's a long-term therapy. And so we generally only see people for about a month and they need it for longer. Our new clinic can follow people for as long as they need this medication and actually couples it along with therapy and case management.
That sounds terrific. That sounds like a great answer to a very big problem. So you mentioned that it's medication based, but you're coupling all the therapy and anything else they may need with it. So take me through the experience, if you would.
A patient in our clinic, they come generally for a 2-hour block. Then in the first hour, they're going to meet with their medical provider and provide a urine drug screen. And then the second hour, they're going to have a psychosocial evidence-based group to help them learn the skills that they need in order to maintain their sobriety, both while they're on medication and then also when they stop. Addiction, you can call it a biopsychosocial problem. There's a biological component, a psychological component, and a social component. And just the medication doesn't actually solve the whole problem. And that's one of the misconceptions that people have about this. They'll say, you're just swapping one medication for another, or that if you just stop there, you're only seeing part of the picture. But when used appropriately, it's a fantastic tool. So we make sure to couple those things together, and we have people meet with a case manager so that any individual needs that they have, we make sure they're attended to.
How do you know if you have a problem with opioids?
Yeah, so this problem is a very subjective thing that has oftentimes a lot to do with consequences. But one of the first things that I'd point to is if you're using opioids, say you've been prescribed them, ask yourself, did I start at this dose or have I been escalating over time? When you start to develop a tolerance and the dose you have to take starts going up and up and up, that is usually that's a biological sign that you might be chemically dependent, which would also mean that if you didn't take it, if you took some extra time off, you start having withdrawal symptoms. You start feeling sick. So those are the surest fire ways of seeing if you have a problem, but also if you're running out early, getting early refills, if you tend to go to other physicians trying to get medications, all those sorts of things can be signs of a problem.
Now, oftentimes, if you're the one in it, you don't see those problems, but you might, have a loved one that is showing all those symptoms. How do you help them? What do you do?
Mm-hmm. Yeah, so actually one of the most important things that you can do is, for yourself as well, if you think that you're having a problem, is reach out and get help. Talk to a professional where you can get hooked into care. And ideally, the end of the road for someone else in your life is you'd like to get them to that point too, because help is the best way to get out of this. You're not, for example, going to get those medications without professional help. However, there can be a lot of resistance from other people when you approach them about this, because oftentimes they feel that the pain medication is how they get through their day, it's how they keep their job, it's how they take care of their kids. There's a really strong emotional bond to it in a way, and it can be very threatening for them to feel like you're going to take it away. So the easiest way, the best way to do it is just talk to them in a very compassionate way about how they feel about it, and start to point out, connect some dots if there are consequences that are stemming from their use. Just point out why did that happen, and just be there, help them connect the dots to build that motivation.
How do people get, if they're listening now or if they have a loved one, how do they get them to your new clinic? Does that come through their family physician? Does that come by walking in? How do you get connected?
Mm-hmm. Well, so there's a number of ways. Linden Oaks is part of the Edward Elmhurst Health System. That's also part of DuPage Medical Group, Illinois Health Partners. We're all one big family that way, sharing the same electronic medical record. So if you come into any of those facilities, we actually have some mechanisms in place to make it easier for them to refer to us. That said, the easiest way to do it is to call the Linden Oaks main line. When you call in, you can actually get a free behavioral health assessment, no strings attached, even if we don't work with you. But looking at what you need and what level of care would be appropriate. But even if you say from the outset that you're looking for this sort of treatment, that helps them guide you to where you need to go and who you need to talk to.
That's wonderful. What can we do to help address this epidemic? Just listening now, or just ourselves. What can we do? What's some tips?
Something that everybody can do is dispose of excess medications. A lot of people, particularly if you have opioids around, from wisdom teeth out or a surgery, or if you sprained your ankle and your physician prescribed a lot, take it to a safe disposal facility. We have them at our local fire departments. We have them at our local police station. Some drugstores have them too. Getting them out of your cabinet is the first step. A lot of children actually end up taking them out of cabinets. That's where they get them, as they raid either your cabinet or friends' cabinets. If you have people come over, it's more common than you'd think. If you get it out of the house, that can't happen. The other thing that we can do is really try to work on the stigma that we can't talk about this, because when this is a problem. Addiction is a chronic disease that grows when it's not treated and when it's not taken care of. And so when people feel like they can't talk about it, or there's going to be significant consequences in their life, then it grows and it becomes more and more problematic. And oftentimes when people are found dead from an overdose, their loved ones in their life had no idea this was going on, where they probably would if they were having a heart condition, or they were having diabetes, or any other chronic health condition. So if we can make this something that's okay to talk about, if we can make this be something that we can disclose to people, that we are comfortable talking about with others, really working on that stigma, I think it would go a long way towards helping this epidemic.
Well, I think you took a great big first step, which coming on and talking about this new program at Linden Oaks, and just getting us a little bit more aware of where it is and what we can do. Thanks so much for stopping by.
My pleasure. Thank you.
And we'll be right back with more Business Connection. Stay tuned.